everyone. My name is Dr. David Kowalczyk. I work with Colorado Facial Plastic Surgery. We've designed a series of educational lecture videos which are short and hopefully provide some information about some of the common procedures that we do. We feel it's really important that patients understand the anatomy and some basic concepts behind the procedures to be an informed consumer. If you have any questions, concerns, or comments, feel free to leave them at the bottom of the video on our YouTube link. We would really appreciate it. Thank you. Hi everyone. Today we're going to talk about upper eyelid rejuvenation. This is also commonly referred to as upper blepharoplasty. So what we'll do to start this lecture is talk about some anatomy. You can see the eyeball here, and you can see the normal position of the upper lid that just goes above the colored portion of the eye, and it ends up reaching the bottom portion of the iris, or the colored part of the eye. We end up having this vertical distance of about 10 millimeters of opening, and this horizontal distance as well, the medial canthus and the lateral canthus. All of these are shown in their relative position to the brow. Now we'll go beneath the skin and take a look at the muscle. There are a number of different muscles that are underneath the lower eyelid skin and the upper eyelid skin, which we're not going to talk about, that serve more specific functions, like opening the eye and closing it as well. The main muscle that you need to be concerned with is the Orbicularis Oculi. That's a circular muscle that runs around the outside of the eye and helps to close the eye. When we do upper eyelid surgery, it's common to take a strip of this muscle out to allow closure and a smoother contour to the upper eyelid. Now we'll go below the muscle layer. So this is close to where the bone would be. You can see the position of the eye. And you have fat pads. When we look at the upper eyelid, there's two major fat pads that surround the eyeball in the eye socket. There's the upper medial or nasal or central fat pad, and then you have the medial or the middle fat pad. Over here, which the diagram doesn't show, you have a gland called the lacrimal gland, which secretes the tears that go down into the eye. The lower eyelid we'll talk about in another lecture, but that has three fat compartments. This is important during surgery. As you can see, we'll talk about the incision, but we sometimes will take out some of that fat to allow for a better contour of the upper eyelid. So since we've discussed the anatomy, how is the procedure done? Well, we make some markings here that have certain distances that need to be obtained in order to preserve the proper anatomy. We typically make this shaped excision area that tapers off into a crow's foot. We end up removing the skin and some of the muscle, taking any excess fat that needs to be removed and contoured, and then closing it with stitches that are typically removed in about 7 days. Here you can see an example of one of my patients that presented for a functional problem. He had heaviness of his upper eyelids due to excess skin and fat. He was having trouble seeing the red light when he was driving, and when he would wake up in the morning, he'd have to push his skin out of the way. It significantly affected his quality of life. You can see how much eye opening and improvement he's had after the procedure. It's important to remember that it's not always done for a cosmetic reason. There's also a functional component many times as well. So one special consideration that may require the assistance of an ophthalmologist is if you present with what's called ptosis. That's where the upper eyelid, for any number of reasons, can be hanging in a position that's low. That requires a more special procedure in order to fix that and can complicate a standard blepharoplasty procedure. One of the last considerations to discuss is the position of the brow. If a patient has a heavy or a low brow, which often occurs with aging, that can also contribute to how much skin is hanging over the upper lid. The reason that's important is we may need to also discuss a brow lift, which we'll talk about in another lecture, which helps move this position up and can help complement how much skin we can remove and the overall improvement in the results. Thank you for your attention. I hope you learned something about the upper blepharoplasty procedure. If you have any questions, comments, or concerns, feel free to leave them in the comments section.